Francisco, Ohio, Western Pennsylvania, and beyond. We're about to put our fingers on the pulse of the Neotropolis. The pulse is pumping live with our host Brian West and the lovely Linda Ray. Myself, I'm Dwayne Watkins, the music maker. And today, our topic is about healthcare. The pulse is brought to you by Method 8 Incorporated. This is a Method 8 production. Take it away, Brian.
Ladies and gentlemen, welcome to The Pulse. We have been all over the topics of hardness and gun violence, but today we're going to talk about health, what it's like to be healthy and health care. The simple necessities of going to the gym, working out, coming home and taking your vitamins, and still finding out that you have a little lump on your leg or on your arm somewhere and you have to go to the doctor. Who has to pay for that? Should your employer pay for it? Should you pay for it? Or should you just have to suffer the consequences and die? This is something that's going on in the world today. When we cover this topic, we're going to grab it by the neck and feel like what it's like to die and want to live. We'll be right back in The Pulse with me, Brian West, Linda Ray, and Wayne the music maker. We're going to go toe-to-toe with death and The Pulse when we're live. We'll be right back in The Pulse with Brian West and Linda Ray and Wayne the music maker.
One day I walked and saw you. Today I sit and think of you. What is this inside of me? Why does this feel so real? I don't even know you, but I feel a vibe that tells me someday to believe in you, to believe in me, to believe in the impossible, to believe in love.
Americans have always paid into healthcare. It's in the tax code. So the question is, did America need a new system, or did the old system just need a boost? In 2013, healthcare.gov was launched. When it was launched, it soon crashed, causing an uproar in the House. Now that the new site is working properly and people are signing up, the question remains is, will the new system work?
Wayne, welcome back. I was hoping Wayne would sing a song to let us know he was alive, but I guess he's battling the healthcare debate. So we're going to get into this topic. Now, my friends, my colleagues, my representatives of the Pulse, of the Neotropolis. Okay, the preamble of the Declaration of Independence talks about the pursuit of happiness and the right for a person to be endowed to their creator. So this healthcare debate is dear to my heart because we have to figure out how valuable our health is. You could be a smoker. I may not want to smoke. Wayne could be a smoker. I may not want to smoke. I could be a smoker. Wayne may not want to smoke. So my health involves his health. This is poetic, ladies and gentlemen. So as we engage in this topic, the Declaration of Independence, which is written by individuals who could have been ourselves, who founded this country, and said that healthcare in itself is a power by the Creator and a choice to be happiness. A long time ago, Dr. Kevorkian used to make a decision whether his patients wanted to make a decision to rather die rather than live. So right now, this is something that we have to discuss. How do we get to this point to where we have to decide as a country, should we all have to pay for health care? Wayne, we got you got most of the spotlight last time. I think I'll chip off Linda Smitty over here, huh, Wayne?
Okay, well, yeah, let me.
Oh, you want to comment? Okay.
Yeah, I want to comment, give it a little, full disclosure is I've worked as an insurance agent.
Oh, wow.
Healthcare. I used to sign people up for healthcare, so I understand what it does, and I, is one of these people who I do believe in insurance. I mean, insurance is one thing. If someone, say, doesn't have healthcare and you still have to treat them, who pays for it? We all pay for it.
We all pay for it.
We all pay for it out of our taxes. And it gets paid whatever the hospital wants to charge because it's in their hands right now, and that's why there was over the years that they wanted to kind of change healthcare because it was kind of breaking us. I mean, if we did have a fiscal problem with with our country, that was one of the problems that we had, the drain on our money.
But now what they're saying, and me and Linda did a lot of rules. She pulled me to the side and she showed me some love. She said, "Brown, we're going to get through this together." You know what I'm saying? She said, "I'm going to take your hand and I'm going to walk you through the aisles of the hospital, and we're going to get through this." So, Linda, how do we get to this point where everybody has to pay now? What did we do wrong? Did we do something immorally? What did you dig up?
Why wouldn't we all have to pay? We all do have to pay. We have to pay for the people who have insurance and people who are uninsured, and people who are Americans, people who are undocumented citizens.
Yeah. So
pay for all of them. What
is wrong? Why is everybody throwing this as if it's not? This has been going on for a long time, if I'm not mistaken. Why is everybody all of a sudden acting like it's just brand new that they got a health care law and now everybody has to make adjustments? Is that what's going on? Am I correct?
Well, the thing about it is it's a change. It just the fight is just over the change of power. I mean, do you want to pay into an insurance? Say you pay your money into an insurance company, but you've been smoking so long that you find yourself with, say, cancer, right?
Yeah.
Now that you have cancer, you've been paying in all of this time. Well, we say we had to do 2 operations on you, just sort of 2 exploratory operations to see how bad your cancer is that you basically caused by doing all your smoking or whatever it is, or and then now you have that thing, so we can the actuaries at the home office will tell you, will call me up and say, "Hey man, you got to get rid of this person. This person is draining draining us for money. So now we got to just send them to the hospital." It's just like what we were talking about before about with corporations. There's things called externalities, which other people pay for. So them being able to kick you off was one of the So the problem with this here new healthcare issue is that people, it's just a power. If you take the power from one to another thing, that's all it is, just a fight over the power of the healthcare corporations or the power of the people.
But now let's figure this out. Now let's dig deep in this, because people are irresponsible. Am I correct, Linda?
Some are, but some can get the cancer you spoke of, lung cancer, from secondhand smoke. And it's not their fault. They didn't smoke.
And we have a problem as a country to where individuals are saying, why should I have to pay for this person when they can't, they can't manage their habits, or they've got. So we've come together as a country, and it says in the preamble of the Declaration of Independence, endowed by our Creator in pursuit of happiness. So it sounds like what people are saying, if this person has pursued happiness to smoke his whole life, I shouldn't have the right to pay for it.
Well, I think it's endowed by their Creator. I think it's life, liberty, and the pursuit of happiness, which is difficult to do when you're sick or you're disabled.
Yeah.
And it's not your fault. Do we owe something to people who have an illness or a disability, and it's not their fault? If we have so much in this country, why couldn't some of that wealth go to those people?
Yeah. So that's
the money is there.
We know it's there. We know it's there. What is the big movement about then? What is everybody complaining about then? If this has been going on for so long, why is it being addressed now? Is it the corporate issue? Is it Is it the money issue, or is it just something that the mainstream just feels need to be addressed?
It's political. I think it's political. I think it's partisan.
What do you power?
Power. It's the power. I mean, you know, if you've been doing something, if you've been doing your show for 12 years, right, and then the network comes over to you and says, okay, Brian, we're going to take the power of the editing power out of you and let somebody else do it.
Yeah.
You're going to have a problem with that, right?
Well, yeah. I mean,
Okay,
I worked for this show.
well, but see, but all things that were worked for were not paid out. I mean, you know, you look at the healthcare. I mean, look how we treat our veterans. We send the veterans to go out and fight. But it takes the VA. It takes the VA so long to be able to process our veterans. Now, just imagine if we had full military where everybody has.
Do you think there's enough doctors though? I mean, are there enough doctors to be able to care for all these people? One thing that I wanted to address too was,
I think so.
If a doctor has let me give you an example. Okay, you don't know everything the doctor knows, but if you know everything the doctor knows, then you make the decisions. So technically, if you know everything the doctor knows and you say, I have a benign tumor, I don't have a malignant tumor, I don't want to be treated, you can go home and you drop dead. Is that doctor legally responsible for you?
Kinda.
So that's how it works.
Yeah, because it's his job. He's taken the Hippocratic oath to do everything in his power to keep you alive.
Now there's been some cases where people have been refused medical treatment.
Yeah.
So how, I mean, if we're gonna, now this is something that's been going on in clinics. It's going on with women who are trying to bear children. So if it says in the preamble of the Constitution that we all have the pursuit of happiness and we all should be responsible as United citizens, what is the big issue, Wayne? I'll let you take us home, and then I'll let Linda hit the home run as we finish and we conclude this talk.
Power, man, money and power. I mean, you know, if you have the ability to buy the Congress up to where they vote to repeal something, say 44 times, and do nothing else,
yeah,
there's got to be an issue. Now, the problem is it's a slippery slope. If they feel that they're losing a certain amount of power, so if they feel that you can take that type of power away, you know, and then another reason is they wanted to do this because one, it takes the power from the employers,
yeah,
and it puts the power back into, you know, the people of their health care. See, most people will take jobs,
yeah,
because they actually have benefits whereby, you know, the new health care, the affordable care, puts it in a light to whereas if you may not necessarily need to work that specific job that you may hate,
yeah,
that doesn't pay you anything, but just so that you can get health care. You might need to do that, and that way, if you have your own health policy, you can go put on your own, you know, shoot your own movies or do something else. Build your own corporation.
Now, Linda, walk me through this, okay, real fast. Conclude us, take us home, okay. I'm in the hospital. I have cancer. My bills are piling up. You are my friend and my loved one, and you know I don't have the money. Walk me through this. How do I get through this? How do I get through something like that?
There are people doing fundraisers. We had a guest on the show, Jim Schaefer. And
Yeah,
friends.
yeah.
They're doing a fundraiser for a person who's ill. That's one solution. But I think the money is there, and I don't think that people should have to go bankrupt.
Yeah.
And many do. In fact, that's the #1 cause of bankruptcy is healthcare issues.
Wonderful, wonderful.
Here, here.
And
Lovely.
should they have to just because of something that's not their fault? And as you say, sometimes health issues are based on lifestyles that can
Yeah.
be changed,
Yeah.
like smoking, for example. But sometimes it's not. Sometimes you get sick and it's not your fault at all.
Yeah.
And should you have to go bankrupt and lose everything because of that?
Absolutely. Ladies and gentlemen, as you heard from the Pulse itself, this show was actually thought of by Linda, or well, the name was thought of by Linda, and it involves life, liberty, and the pursuit of happiness. We are all in this together. We all love each other. We're going to come back and we're going to have a skit. We're going to have some musicians and we're going to take it out. But we're all in this together. We'll be right back in the Pulse with Brian West, Linda Ray. Choose life, love life, and enjoy life. You're not alone. We'll be right back in the Pulse with Brian West.
Method8Inc.com and Method8 Arts Academy is a proud sponsor of the arts. Our productions can be viewed on our Method8 Corp YouTube channel or by visiting Method8Inc.com. All of our productions focus on conscious building issues with films like Miracle, The Land of Escobar, The Birth of the Dreamer, which deal with women's
You touch me, you understand? Don't you ever touch me. I work too hard for this, Precious, to make ranks, and I don't have time to go through this, okay? You know, even if this baby is mine, you get rid of it, okay? You get rid of it. You understand me?
Okay, Walter.
Method8's Indian Summer, which focuses on sacrifice,
Complain. That's all you humans do. What, you think I poisoned your food? You think I'm some kind of killer? Lamani's not coming back.
or Academy Special Projects with shows like Field Angels to help combat youth violence.
Here, Friedman. President Bixby wants to shut you down.
Shut us down! Shut us down for what, Friedman? We're just getting started!
They say you've been using little girls to crack cases.
You put your hands on me, Freeman! I don't care! We've lost Penny, Raven, and Sparks! I'm the only one left, Freeman! We're gonna solve this! We're gonna turn this whole damn city into the kingdom after I get done!
All these productions can be viewed on our YouTube channel. All donations can be made at Method8Inc.com. Every donation goes towards productions to combat issues to save lives, with classes and funds to train and support the actors. All sponsors are recognized in every program. It is the belief of every representative at Method8 to believe in their abilities and to use art to save lives. Show your support today at Method8Inc.com.